it was ruining my life at home, my life at work. It was just so taking control of me.
He was in his mid-40s, an average middle-class husband and father. He could be anyone. He lived in fear that his terrible secret would be discovered.
Well, it came down to a point. It was Labor Day weekend in 2011. I sat down in the basement. I was on a weight bench. And I looked up at the rafters, and I thought I could do it here. And I was contemplating putting a rope up there and hanging myself because of the pain. It was so great.
A veteran of the drug life, he's in his mid-50s.
They're only 10s, I know.
Oh, they're charging
Drugs have long since consumed his life.
No, I get them for 2. It makes me sick to look at these things. On a daily basis, I have to look at these scars. 800 stitches back and forth. The carpet knife was, when he used it, I heard him grunting. I wouldn't wish it on anybody, you know. It's just a painful, traumatic thing to happen. Getting stabbed, getting shot, over drugs.
The face of addiction is changing in Ontario, with more people like Randy Kellum becoming dependent on pharmaceutical drugs rather than illicit street drugs. Opioids, and Oxycontin in particular, represent a growing threat, according to the Centre for Addiction and Mental Health. Canada is the third highest consumer of opioid medications per capita globally, and Ontario residents use them the most, according to the Ontario Ministry of Health and Long-Term Care. Kellum's problems began after major reconstructive knee surgery in 2006.
Because of the pain, the extreme pain, I was prescribed Percocets for short pain, and then I was told about this drug called Oxycontin. I was prescribed it, and I was told by my doctor, 12 hours, long-acting, and I'm pretty sure my doctor said non-habit forming at that time.
Kellum was always a good husband and father and has never been in trouble with the law. But like so many others, his use of Oxycontin spiraled out of his control.
I found a friend who knew a friend that dealt it. I was shocked at the price of it. 140 milligram tablet was going for $25 to $30 per tablet. They also had this other one, it was a green one called an 80 milligram tablet. Now that's like taking 16 Percocets at once. I started buying the 80s, and depending on supply and demand, they would go from a low end of $45 to a high end of $60. He would say, I'll give it to you for $50 because you buy so many off of me. And he'd say this, you feed my family. This is what the drug dealer used to say to me. Now I was buying 10 to 12 of these a day at $50 a piece. Do the math. It's $500 to $600 a day. Well, I went through my savings, I went through my line of credit, I went through my credit cards. My wife signed over her savings to me, and it was a large amount. It was $28,000. Her RSPs that she'd been saving up all her life. She signed it over to me because I had everybody convinced the bills were getting out of hand. And because of all her spending, this is what was happening. Meanwhile, I took that $28,000 and I was going to the drug dealer.
For Ducis, each day is a battle with his addictions. A battle the drugs often win. Through his pain and the destruction of his body, he wants to save others from a similar fate. He feels it's his responsibility.
Drug addicts with a purpose feel like they're fulfilling, like they're necessary. That's the problem, I think. They feel empty. Like they're not able to, they're definitely not accepted by society.
His body has been ravaged by over 35 years of drug abuse. To successfully inject, he is forced to hit the femoral artery in his groin. All other veins have long since collapsed.
It's because my leg will be burning from the bottom of my leg all the way up. I contacted from drug use hepatitis B. Tuberculosis was the first, spinal stenosis, arterial sclerosis, I was forced to inject in areas that you wouldn't dream of injecting, like in the neck, the surface veins, the luminous, the more soft veins in the arm were destroyed. I couldn't use them anymore. There was no blood running through, so I had to go in areas. I had to rotate. I had to go in my upper arm, in my neck, in my legs. If you look in some areas, you can see where the actual injection sites were. You can see the injection sites here. These are areas where huge ulcerations, the depth of an inch, the width of 3 to 4 inches long, 4 inches wide, had to be cleaned out. Took 3 years to heal. This is why I try, like anybody who's gonna educate himself or other people about the dangers, I'm all for it. I'll help. You know, my life's a mess because of drugs. I don't want to see other people get hurt. I'm haunted by faces every day of people that have died, people that have I'm talking about hundreds of people I've known have died, overdosed, died as a result of drugs. Good people, people I loved.
Kellum's guilt about his addiction was more palpable because his family had already been tragically affected by opioid drug abuse.
My sister, Nadine, died 4 years ago, and she had tried her best, and she died from withdrawal.
Really?
Her heart gave out at a friend's house.
Kellum recalls when he hit bottom and how he finally found salvation.
You know, it got really bad at my house, really bad. You know, I'm up in a hospital bed, and my oldest son called me when I was getting help, and he said, I can't believe my father's a drug addict. I can't believe this, Dad. You're a loser. I will not call you Dad anymore. I hate you. And he slammed the phone down. I just got fired from my job. My wife called me up. She says, I know you're having a bad day, but they just shut the water off, and I can't even take a bath. You know, here my wife and I are both professional people. She's a manager at a very large company, and I was a manager at a company too, and we both made great money, and we couldn't even pay the water bill. That's where the drug had taken us. Not up to me, but I had done that to the family. So I'm living in such shame and guilt in that bed up in the hospital, but I hung on to the hope that I was going to get better. And if it wasn't for that hope, and it wasn't for the doctor Mohan that put me on that methadone, or was going to at that time, he came in and talked to me, and he totally understood my thinking, the pain. I mean, and if it wasn't for that, I don't know if I would have got through that day at all.
About 85% of the patients in a methadone practice is considered stable, and there's about 15% we consider unstable. This is the basis on which we have a patient under harm reduction. And compare this to the patient on the street who is not involved in a program. They are much greater risk of death from substance use. And this is borne out by the people we see coming into the emergency room, either in coma or actually dead.
For Dutzis, the future is uncertain, and each day remains a challenge.
I hope that through my pain and trauma, it will help some make the right decisions for them about drug abuse.
For Kellum, the future is brighter. His message is simple.
That's a little bit what this is about, is the methadone treatment program. If it wasn't for that, I wouldn't be talking to you today. Because there's no way I could have stayed away from the grip of that drug. People have had to die because of that drug. Shouldn't have to die. Plain and simple, I just want to say this. If you're being prescribed it, say no. Take the courage, take the step. You'll thank yourself 1,000 times over. If one person can do it, this interview is worth it. It's worth it because one person's life is worth all the gold in the world. It really is. There's nothing more important than life, you know, and that's it.